Hey, it's Dr. McCarthy, and welcome to today's 12 Days of Christmas Holiday Health Tip. Today we're going to talk about one of the tests that we do in our office very commonly. It's a very important test called the adrenal stress test. If you look like this, you need this test done. What this test does is it's a very simple procedure. It's a saliva test. You take 4 saliva samples throughout a 24-hour period, and it measures a lot of different things, but the main thing that we look for are your cortisol levels. Cortisol is a hormone that's produced in your body, and it helps to wake you up in the morning, and when the cortisol goes down at night, it helps you to fall asleep at night. It's very closely related to your blood sugar, and if you don't do a good job maintaining normal blood sugar, your cortisol levels are very likely to be thrown off. As well, if you can look here on the chart, the 2 red lines here, that's where the normal cortisol levels should be. This is at 8 a.m., and as the day goes on, you see your cortisol levels are supposed to be dropping. This patient here, the white line, that shows that this person actually has low cortisol in the morning, and it gets way too high. This person cannot get to sleep, or worse yet, cannot stay asleep. This is a common situation we see in people who have chronic health conditions. Cortisol low in the morning, too high at night. These are people who want to take a nap at 3 in the afternoon, and they're wide awake at 3 o'clock in the morning. This is something that is, I don't want to say easily corrected, but it's something that we can correct by changing the foods that you're eating, changing when you're eating, and basically just getting your blood sugar stabilized again, getting your blood sugar normalized. Some of the other things that can induce cortisol release would be problems in your nervous system, sympathetic overflow, too psyched up, glycemic dysregulation, the blood sugar we were talking about, tissue damage, inflammation and pain, and also mental and emotional stress. When we deal with these things, this all creates this cortisol release, so you've got to fix these things in order to fix this. This person right here, very commonly, this person walks into my office with this high cortisol in the evening. They can't get to sleep. They go to the traditional healthcare provider and they're given sleeping pills. Well, sleeping pills will artificially make you fall asleep, but they're not going to fix this cortisol pattern. So this person's going to need to take sleeping pills for the rest of their life. I would say, let's fix this instead and throw the pills away because you don't need them. It doesn't fix the problem. Another thing that we assess on this same adrenal stress index with the saliva test is hormones. We look at your hormones. The most scientifically valid and reliable way to check the free fraction of your hormones is through saliva testing. And we do separate panels. We do male panels where we'll check your testosterone and DHT and your androstenedione. Females will check your different forms of estrogen, progesterone. We'll check in males and females both luteinizing hormone, follicle stimulating hormone, DHEA, 17-hydroxyprogesterone. All of these things are checked very accurately when we do these hormone panels. The issue is we do this adrenal stress index, we implement different protocols, whether it's to maintain cortisol levels in proper ranges or to change your sex hormones. If you're estrogen dominant and you're a male, that's not a good situation. So we introduce our protocols, and then we run the test again a few months down the road, and we can see how all these levels come back into the normal patterns. If you're having a problem with your cortisol, with sleep, with stress, if you're having a problem with any of your hormones, I urge you to call our office, tell Kathy that you want to get the adrenal stress index done, and I will see you next time. Thanks.